So, good morning, ma'am. I am Maria Alexandra Garnizo, and I am your student nurse for today. So, for today, I will be the one who take your personal data. So, it's okay with you, ma'am?
Yes po, ma'am.
Okay, so let's start. Today, I will be asking questions regarding to your clinical assessment. So, when did the problem start, ma'am?
This year,
Okay, so what did you notice first po?
I get frustrated easily to the things that triggers me.
Okay, so did you have any problems or symptoms related to this?
Yes, I am having hard time sleeping.
Okay. So, what makes the problem worse or better, ma'am?
It makes worse when I am surrounded with the negativity things, and it can make me feel better when I am open up with other people.
Okay. So, next, ma'am, we will proceed to past health problems or status. So, as a adult, did you recall back your childhood about any illnesses and childhood illnesses like chicken pox?
No,
How about mumps po?
no.
Okay. So, have you asked your parents before for having immunization or vaccine as a child?
Yes,
So, do you recall the immunization or vaccine, ma'am?
yes, I had vaccine like hepatitis A and B, and for measles, mumps, rubella, and polio vaccine. And this year, last year rather, is for the COVID vaccine.
Okay, ma'am. So, are you up to date your vaccines or immunization, ma'am?
Yes.
So next, we will proceed to family history of illness. So now, I'm gonna ask you a few questions about your family background or if there are any diseases present in your family. So, do you have any family member that has any diseases or any illnesses, ma'am? And how old are they?
Yes, my grandfather has high blood. He is 71 years old. And my grandmother has a hyperacidity. She is 68 years old.
So, how about someone has asthma, cancer, mental disorder, hepatitis, and heart disease, ma'am?
They don't have any kind of illness.
Okay, so they are not okay, so that's good. So, how old are you when you start having your first menstrual period, ma'am?
When I am 12 years old,
Okay, so when is your last menstrual period?
this March 3.
March 3. Okay, so um, how many days is your menstruation?
It usually lasts 7 days, 5 to 7 days.
Okay, 5 to 7 days. So, how many pads did you use per day po, ma'am?
Three pods per day.
Okay, 3 pads per day. So, what did you feel if you have menstrual problems? And what is your usual remedy to ease the pain po, ma'am?
When I have menstrual period po, I felt I'm craving something and I have dysmenorrhea.
Dysmenorrhea. Okay. So, next, ma'am, have you ever had any serious injuries that needed you to go to the hospital or seek medical care?
I don't have any and was injured.
Okay. So, have you ever been to the hospital again beside you were born?
Yes, mom, when I am 13 years old, as what I have said earlier, I have dengue.
Okay. So, do you have any medication you take every day?
I don't have any.
Mm. Are you allergic to anything else like foods or drinks?
I don't have allergies also.
Mm. So next is about your educational background, ma'am. So what is your educational background po?
Okay, I graduated Washington Elementary School and I graduated Montfort Technical Institute when I was in senior high school days. And I am a college student for now at Aklan State University.
Okay po. So are you working?
No po,
So what religious practices that can affect your health po, ma'am?
I don't have any.
Okay. So who are the important people to you po?
My mother and my father.
Okay. So what is your social role, ma'am?
I am a student, college student.
Okay. How is the environment around you?
It is okay, mom.
So, ma'am, did you have respiratory problem?
I don't have any, mom.
Okay. So, how many times do you breath po per minute or your respiratory rate?
17 breaths per minute usually.
Okay. So, what is your usual blood pressure po, ma'am?
My usual blood pressure is 120/80.
Okay, so it is in normal range. So, do you have any history of chest pain po, ma'am? Palpation, coldness of extremities, and many others?
I don't have any, mom.
So, okay. So, what is your usual bedtime, ma'am?
1 or 2 a.m.
So, How about the time did you wake up po?
7 o'clock a.m.
And how about your nap period?
From 5 o'clock p.m. to 6 o'clock.
So, how about your total number of hours of sleep po, ma'am?
It's usually 5 or 4 hours of sleep.
So, next we will proceed to bedtime rituals. So, what are your bedtime rituals, ma'am?
Praying before I sleep.
Okay po. So, do you have any problems regarding your sleep?
Yes po.
So, what is your usual remedy, ma'am?
I I just watch videos until I felt asleep. And to avoid overthink so that I should sleep peacefully.
So, okay. So, how much fluid do you intake a day, ma'am?
10 glass.
Okay. So, what types of fluid do you intake and how much its amount po?
I take fluid like water. I usually drink it 9 glasses. And for the coffee, which is 1 glass.
So, okay. So, next we will proceed to your eating patterns. So, at breakfast, what are the usual foods you eat and what time is it?
For the breakfast, I eat biscuit and it's 7:30 a.m.
Okay. So, at lunch, what are the usual foods you eat and what time is it?
I usually eat chicken and rice, and the time of it is 12:30.
Okay. So, at dinner, what are the usual foods you eat and what time is it?
For dinner, I usually eat rice with soup and fish. It's usually 8 p.m.
Okay. So, for snacks po, ma'am, what are the usual foods you eat and what time is it?
I eat for snack is shawmai with rice, and it's usually 5 o'clock p.m.
So, okay, ma'am. Next, what foods do you like, ma'am?
I like spaghetti, noodles, and chicken fillet.
Okay. So, what foods do you dislike naman po, ma'am?
I don't like ano, like leafy vegetable.
Okay. How many times did you poop po, ma'am?
10 times a day, 1 time.
Okay. So do you have any problems when you are pooping po?
I don't have.
So next, ma'am, we will proceed to your elimination patterns. So first is how many times did you poop po?
One a day.
So do you have any problems when you are pooping?
I don't have any.
So how many times per day did you urinate or ihi po, ma'am?
6 to 8 times a day.
So do you have any problems when you are urinating po?
I don't have any.
Okay. So next, we will proceed to your exercises. So do you exercise, ma'am?
Yes, I like biking.
So how do you find doing exercise po?
I felt relieved and happy.
Okay. So next, we will proceed to your personal hygiene. So when you are taking a bath po, ma'am, what did you prefer po? The cold, hot, or warm water?
Warm.
Okay. So how many times did you take a bath po per day?
2 times.
So how many times did you brush your teeth po?
3 times a day.
So did you have any care of dentures?
I don't have any problem.
Did you shave usually, ma'am?
I don't.
So what are the cosmetics and toiletries did you usually use po?
I usually use soap, shampoo, conditioner, lipstick, powder. That's all.
So what is your recreational activities did you do, ma'am?
I don't have any.
And for the last question po, did you believe po in any health supervision? Like doctor, dentist, albulario, and herbman. So, what kind of health supervision did you believe po?
I believe in doctor, dentist, and herbalist.
So, that's all for today, ma'am, and thank you for your cooperation.